This video essay will address the issue of elder abuse. Elder abuse can manifest in many forms, with psychological being the most common. 1 in 6 Australians experience elder abuse, and as such, it is an important issue for paramedics and the general public to be aware of. Paramedics need to be trained and equipped to recognize and assist patients experiencing this type of abuse, as paramedics are often first on scene in these times of crisis.
Based on the QAS CPG, QAS paramedics must assess and identify the abuse, whether it's physical, medical, or mental. They must assess and determine the scope of it if it requires immediate response and attention. Paramedics must also account for the mental and emotional state of the patient. Once abuse has been identified, paramedics need to safely plan how to respond to it, avoiding aggravating the situation. Paramedics then can contact or seek advice from the Queensland Government Elder Abuse Helpline to create a safety plan for the patient. This agency will help the patient to connect with the appropriate services and support they need. Paramedics then must properly document and detail any findings, as well as give a detailed handover to hospital personnel. This must include clinical findings, environmental factors, and any sign of abuse or neglect, any advice and support given to the patient, and any actions taken.
Elderly people who experience abuse are at risk of negative physical health and mental health outcomes, as well as negative social outcomes. This is including but not limited to physical injuries, premature mortality, depression, cognitive decline, financial devastation, and premature placement in nursing homes.
Elder abuse is a vicious cycle, with those who have pre-existing health conditions at an even higher risk of becoming victims to abuse. As a consequence of the abuse, we may see the exacerbation of these pre-existing health conditions or the development of new ones. Thus, the cycle of abuse begins. This can also be applied to those with pre-existing mental health or psychological conditions. Unfortunately, it is entirely possible and not uncommon for both physical and mental health conditions to occur simultaneously in one person, increasing the risk of that person falling victim to abuse and causing the exacerbation of these conditions due to said abuse. This poses a significant threat to an individual's general well-being.
Specifically, they're at higher risk of poor physical health outcomes such as bodily pain, diabetes, weight problems, digestive problems, incontinence, allergies, disability, and exacerbation of pre-existing health conditions. Poor psychological outcomes such as depression, negative emotions, anxiety, stress, suicidal ideation, attempted suicide, cognitive decline, dementia and sleeping problems, as well as general social dysfunction. As a result of these health and social implications, there are increased hospitalizations, emergency department visits, and use of behavioural services among this demographic. Because of the increased use of health institutions to facilitate care relating to elder abuse, a strain is naturally placed on the health system. There are several factors that contribute to this strain specific to the elderly demographic, including elderly people being complex patients and are at high risk for complications if admitted to hospital, such as functional decline and hospital-acquired infections. If abuse isn't reported and adequately managed, it could lead to repeat presentations to a health facility. Health decline and development of health conditions because of abuse, increasing the need to access a range of health services. Broadly speaking, elderly patients are already extremely vulnerable, and as a result, health conditions and comorbidities can easily exacerbate and lead to significant health decline. When elder abuse occurs, the already high risk of health deterioration is notably amplified.
Novel paramedic strategies includes continuing professional development focusing on the specifics of elder abuse, including identifying groups within the elderly demographic that are particularly at risk of abuse, identifying general risk factors for elder abuse, identifying signs of elder abuse and what to look out for in a pre-hospital environment, identifying the types of elder abuse and the impact of different types of abuse, and once identified, how to effectively approach a situation where abuse may be occurring while ensuring patient and paramedic safety is maintained. Benefits of this strategy include reduced cases of elder abuse, reduce significant health decline in elderly demographic, and reduce strain on the health system. Furthermore, in terms of cost effectiveness, early intervention can reduce the need for repeated emergency care, hospitalization, and targeted public health interventions, ultimately reducing the broader social and financial costs associated with elder abuse. Finally, the goals for this strategy include overall a reduction of instances of elder abuse, early identification and intervention in cases of elder abuse before significant health decline occurs, prevent elder abuse related to strain on the health system, paramedics to feel more equipped to deal with the cases where elder abuse is a factor, and lastly, paramedics have the knowledge and skills to be able to identify factors surrounding elder abuse.